This is Dr. Joe Feuerstein with the MD Minute. Thanks for tuning in. And today I want to talk about medications that reduce acid in the stomach and B12 deficiency. So this study was just published in the Journal of the American Medical Association, coming out of researchers in California. Lots of people have acid issues, causes ulcers, causes gastritis, inflammation of the stomach, and very commonly two classes of medications are used. One is called a proton-pump inhibitor, such as Protonix, Prevacid, Dexilant, and that reduces the acid in the stomach. Another class is an older class called an histamine or an H2 blocker, and that's things like Pepcid and other such medications like ranitidine. We use them all the time, and there are in fact some risks. So in this study they looked at 25,000 people who had B12 deficiency, that's a reduced amount of B12 in their blood, and compared that to 189,000 people who didn't. What they found in this study, which was huge, was that if you were on a proton-pump inhibitor like Protonix or Dexilant or Prevacid, your risk of having B12 deficiency was 65% higher than if you weren't on the medication. If you were on a H2 blocker like Pepcid, ranitidine, your risk of having B12 deficiency was 25% higher compared to someone who wasn't on that medication. So my take on this is that it is important to use these medications judiciously, not to use them for too long, and to be sure that you ask your doctor to have a B12 test, because your risk of B12 deficiency is high, and B12 is important for many things, including mood, including neurotransmitter, the stuff that helps with our brain and keeps us happy, and also very, very important in nerves and very important in anemia. Dr. Joe Feuerstein with the MD Minute. Namaste.